Hello, and welcome to another episode of Cutting Edge Health. I know this is an unusual video, one that's coming on a different day than typical for our live stream. However, I felt there was an important topic that needed to be covered and something that I would be remiss if I wasn't explaining and having people understand exactly this is something that you need to be bringing up with other people. I got back from a recent medical conference that talked about the utilization of one of the treatment technologies that my clinic uses and is fairly familiar to a number of different practices. The practice itself is something that's called transcranial magnetic stimulation. And in attending that conference, we found that there was a new indication for being able to impact a population that is at incredible risk. And that risk is teenagers. And those individuals are people who sometimes don't always have the greatest advocates for themselves, right? So one of the things that we've been seeing is that teenagers have had an increasing suicide rate that just really startled me. I just didn't know it. It's not something that I normally commonly see or like deal with. But as we were looking through the literature, we saw these things about not just here in the States, but across the globe, where there's this increasing suicide-related deaths from kids even from as young as 10 to 14 years of age. And to me, I just feel like that's just wild. And as we start digging into the literature, one of the things that we saw is that there's been a steady increase in terms of the numbers of teenagers from early, into 2010s all the way to current. And one of the things that has been really remarkable is that it's recently surpassed homicide rates. And so it's number 2 in terms of death for those between 10 and 24 after accidents. And so I was at this conference and I was listening to it, and the CEO of the company actually came through and talked about, one of the things that they're looking at is how to be able to try to decrease depression and suicide rates across the board, particularly in adults. But they have a base that's present in and around North Carolina, Charlotte and such. And over the last couple years or so, there have been these significant deaths that have taken place in and around colleges in that region. So the high schools have had 2 suicide actual, not just attempts, but completions in the last few years. And I felt it was appropriate because I think that there can be sensationalism with YouTube videos and such. And so I didn't want to show pictures and go into the depth and details of the articles because I feel like that's disrespectful not only to the person, but also to their families. So I'm not going to link all those type of things. But in the colleges in North Carolina, they've also had 12 North Carolina state students die by suicide in the course of 22 and 23 in the span of 24 months. And so it spurred the CEO to say, you know what, we need to really start looking, how can we be able to look beyond just our indication for people that are 18 years and older? And so accordingly, they approached the FDA and they were able to take a look at the registry and show that they are able to provide safe and effective treatment to patients that are younger than 18. The current indication is all the way down to 15, which is really not only unique and interesting, but also incredibly valuable. So as we kind of delve into this aspect of this crisis, one of the things that we've been seeing is that there's been an increase in thoughts about suicide by 40%, which you would think shouldn't be something super surprising, but it certainly was surprising to me. What they stated is that 60% of teen girls have had this feeling of persistency, sad, or hopelessness, and 30% have considered suicide. And more than 6,600 people between 10 and 24 have died by suicide in 2020. Going on, what they've been able to kind of really delineate is that although the mortality rates overall have decreased to an extent, the percentage of deaths have increased and continue to increase. So as a quick aside, yes, thank you for those who are joining. And one of the quick comments is sad to hear, and I completely agree. It's incredibly sad to hear. So let me just make a divergence. Before we start talking about therapies and all these other type of treatments and the success rate, for those of you who have people that are in your lives or people in their lives, we're just going to post a couple different numbers and methodologies of how people can be able to find success and help for their person that they care about. So there's ways to be able to deal with this. That's not just phone. As we know, sometimes kids are much more, and I don't mean it in a disrespectful way, but adolescents and young adults are more likely to text. And so there's different numbers for you to be able to use for text. And kind of jumping towards the end of our talk, there's a couple other different resources like the following, which you can be able to utilize, that has a number of different languages, not just English, but also Spanish and a number of Asian languages as well. In addition, there are suicide hotlines that are in place and ways to be able to go into websites like suicide.org. That is a nonprofit that has a number of different outreach, which are specific for individuals that allows them to be able to deal. So 1-800-SUICIDE or 1-800-784-2433. For those who are LGBT, ways to be able to kind of deal with specific components for those people who are Spanish speakers, 1-800-273-TALK. For military veterans who are going to be contemplating potential suicide, similar type number. So at the end of the day, I feel like those things are important as a resource. And then let's talk a little bit about the aspect of this therapy. So Neurostar has received FDA clearance as a first-line treatment for adolescents. And so I know that that seems fairly simplistic as a statement, but first-line therapy basically means that the person can get approval right off the bat. You just have to meet indications for depression. You don't have to jump through hoops of having tried this and other different types of treatments like you do in the adult population. Normally, you have to have counseling therapy that has to have taken place. You have to have tried a number of different medications. So in essence, without me being maybe too glib and direct, insurers have looked at this and said, you know what? In some ways, what we consider how can we look at what are the finances behind this and see, can we use cost-effective measures, if you would, to be able to have someone take medications prior to considering doing TMS? This is important. And so accordingly, we need to do something that actually goes outside the box and says, can we help save these people, right? And so the first-line therapy is a major difference. And it seems subtle in the initial statement, but it's certainly grander than that. And you may not be able to read this, but I'll try to read it line for line so you can be able to kind of pick it out. But basically it says it's this FDA clearance to treat adolescents from ages 15 and up is long overdue in the mental health industry. And so this is from the CEO of Neuronetics or Neurostar. And they're excited because it's a new option for young people and for concerned parents who struggle to find a treatment that can be confident. As a company, we'll be focused on driving even more awareness. As an aside, for those of you who follow our channel, one of the things we want to kind of talk about is, so May, which is upcoming in the next few days or so, is Mental Health Awareness Month. We'll be doing a number of different talks in that regard so people can understand mental health is actually something that should be looked at from both a wellness as well as an illness component of how can we be able to foster good outcomes and overall beneficial, how can you be able to lead the life that you deserve. But be that as it may, as we kind of talk about this, what most people want to know is, does it work and is it safe? So what we know is that 1 out of every 5 adolescents experiences at least one major depressive episode here in the States. The machine that we've talked about on others looks like this. And although as I've introduced a number of different patients to it, it kind of looks like the Star Trek machine or something that you would see. The fact of the matter is it's incredibly effective. When we look at a pediatric population, those patients that come in, 78% of them get some improvement in their depression. And 48%, nearly 50%, it's resolved completely. That's what remission means. So to kind of repeat that again, 48%, to quote the numbers, but nearly 50% are able to stop depression and be done with it, not have it being a lingering thing. But of those patients in general, 78, nearly 80% of people who come in and have TMS done, it's resolved. And this is in the pediatric population. There are similar numbers that are present in the adult. When we kind of come back, we look at that specific statement, you can see that the report of the FDA being able to get authorized this as a potential treatment going forward. Still, some of the insurers are catching up. As I mentioned before, now that we know that it's effective, is it safe? And what basically this is the kind of full statement is 10,000 adolescents have been treated with over 300,000 sessions. And the thing is, when you compare this head to head to antidepressants, which many people say, oh, well, this is what we should do. Actually, in teenagers, it can be potentially problematic because what we see is antidepressants were traditionally trialed and tested on adults. And so one of the things that they've seen is that perhaps it can impair and impact children in a different way, particularly in terms of their overall safety, and if it may actually increase thinking that can be harmful. So I felt it was important to kind of have a conversation quick, not push it off into later into the week, to talk about a therapy that's out there. And hopefully it helps someone, not just here and close to where our clinic happens to be, but anyone who's listening to this. Again, to kind of run through some of the different resources for kids and individuals in general. There's a number of different lines out there that you can reach in order to be able to get help and be able to prevent this from happening. Suicide.org, the different numbers like 1-866-4U-TREVOR for certain individuals, 1-800-273-TALK. And at the end of the day, one of the things that makes me kind of think about this is when I was in high school, I lost one of my best friends to suicide. And I wonder what he could have been if he'd had the opportunity. So I think about it with some degree of frequency. And I wonder, how this would be as a parent. I feel like it would just be devastating. So for us to be able to avail ourselves of a treatment that can be able to stop this without the sequelae and know about it even as an option is something that we should make, to me, the people in our lives that we care about, let them know. Thank you so much for attending this. And if you're watching this at a later time, by all means, please leave comments. Let us know if there's something that we can do better. And hopefully this helps someone. Thank you so much and have a great day.